Okay, let's talk about other things that can cause malabsorption, because this is very, very common. A lot of times when people come to see me in my practice, a lot of times they've been to 7, 8, 10 doctors. They're on multiple medications. They're struggling to find an answer. That's why they're in my office. And it's a very common trend that we see people on multiple medications. As a matter of fact, I had a woman here last week. She was on 15 different medications. She had like 6 different doctors. None of the doctors were talking to each other about her medicines and the interaction between her medicines or the damage that her medicines could do to her GI tract by causing malabsorption. And so here she was being told she had to take these chemicals to suppress her symptoms. She wasn't getting better, and she was stuck, right? And this is a common scenario that I see. So these are just some examples. Antacids, reduce stomach acid, right? That's what they do. They block your ability to produce stomach acid, which is going to cause what? It's going to cause protein malabsorption. You're not going to be able to break down or digest your proteins. But some of the minerals also require acid to be absorbed. So minerals like calcium and magnesium and zinc and selenium and chromium and copper require acid in order to properly be absorbed. So if you're blocking your stomach acid, taking the pink stuff or even some of the over-the-counter remedies and some of even the prescription remedies or the prescription PPIs, things of that nature, you're causing protein and mineral malabsorption. You're also causing, it's not just mineral, but B12 requires acid to be absorbed. And so blocking acid oftentimes leads to vitamin B12 deficiency. We also know antibiotics can cause malabsorption. They do this by damage to the microbiome. So if you, functionality-wise, they damage the bacteria that thrive and survive in your GI tract. The bacteria, remember, what do they help you do? The normal healthy bacteria in your intestines help you digest your food. If you wipe them out on a frequent basis by popping antibiotics every time you get a fever, this is especially true. We see this very commonly in pediatric practices today. Then kids got a snotty nose, they get an antibiotic. Like, it's insane. It's insane how asinine we've come, how far we've come in such a terrible direction where it doesn't matter. Doctors don't do cultures anymore. They don't confirm bacterial infection. They just write the prescription despite damaging the microbiome, which is so critical to human health. And so we see this deterioration of the human microbiome over the last several decades. It's no wonder our kids are so sick, struggling with asthma, struggling with obesity, struggling with multitudes of immune problems. And again, those antibiotics can be a major part of this problem because they damage your microbiome. And your microbiome, not only does it help you digest your food, but you remember your microbiome also produces vitamins. So a number of your B vitamins are made by your good bacteria. Vitamin K, K1 specifically, is made by your gut bacteria. And really about 60% of your daily need for vitamin K comes from your microbiome. So if you're taking antibiotics on a frequent enough basis, you're going to create nutrition deficit as a result. Chemotherapy, this is something we see all the time, cancer patients. Chemotherapy destroys the GI tract. And so this is why one of the side effects of chemo is severe nausea, vomiting, and diarrhea, because it destroys those very, very delicate cells. And so, again, the problem in cancer is, doctor says, eat all the foods you want, we just want you to keep your weight on. Well, it's because they're giving you a poison that destroys your GI tract and causing you to become malabsorbed. How are you going to fight a cancer if you're malnourished? Like, it makes almost zero sense to do this to somebody without addressing the nutrition. But how many oncologists, how many times have you been or seen one of your family members with cancer, have an oncologist order a vitamin mineral deficiency test to help support them on their cancer journey? It happens 0% of the time in my experience. Now, maybe you've got a different experience, but in my experience, 21 years, I've never seen it. I've never heard of a cancer doctor making these kinds of recommendations to help somebody with their nutrition. We also got drugs like ARBs. ARB stands for angiotensin receptor blocker. It's a type of blood pressure medication. These drugs, about 137 studies have shown that these drugs can cause villus atrophy. And it matches or looks just like the villus atrophy that can be caused by gluten. So what we would call celiac disease, right? Gluten causes flattening of the folds of your small intestine, leading to malabsorption. This class of medications can cause villus atrophy. And so you have to be very, very careful. If you're on an angiotensin receptor blocker for your blood pressure and you have problems in your GI tract, you need to have that conversation with your prescribing doctor that this is a possibility, that you're taking a medicine that could be causing malabsorption syndrome. There have been a number of studies published on this, a more recent one published at Mayo. Then we have a drug class called bile acid sequestrants. Now, these are an older class of medicine. These drugs are used to reduce cholesterol. Now, not commonly prescribed as they used to be, because statins, a newer type of cholesterol-lowering medication, are what most doctors use. But some people don't tolerate statins, and so a lot of times the doctors will reach for bile acid sequestrants. And what do these do? They basically cause malabsorption of vitamins A, D, E, and K, and then other fats, right? So your omega fats. And so over time, you multiply taking something like this out over 2, 3, 4, 5 years, and you start to see malabsorption really setting in. And then fat malabsorption is a very bad deal. You don't want to go that road. Now, a few that I didn't mention here, a few of them, non-steroidal anti-inflammatories also cause damage to the GI tract, leading to malabsorption. We also know that steroids, so if you're taking chronically, if you're taking oral steroids like prednisone, corticosteroids, we know, and if you're mixing these two, the damage to the GI tract is about 8 times more aggressive than if you're just taking one by itself. We also know medication that's commonly prescribed and over the counter is aspirin, and we know aspirin in baby aspirin, which is about 81 milligrams. So if you were to cut an 81 milligram aspirin into 10 small pieces, each of 8 milligrams each, that 8 milligrams, 1/10 of a baby aspirin, is enough to cause damage to your mucosal barrier in your stomach and cause gastric bleeding. 1/10 of a baby aspirin can cause gastric bleeding and damage. So again, if you're taking these things chronically, I'm not talking about I had a headache once and I took a little bit of aspirin. I'm talking about if you're using them on a regular basis, you're going to run into a major problem, again, with the drugs creating damage to your intestinal tract, leading to the potential for malabsorption, nutrient deficiency, and lack of healing. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.